I want to talk just a little bit about ADHD. Do you want that, Jim? Okay. ADHD, or attention deficit hyperactivity disorder. You could also simplify it as an adrenaline deficit. And specifically in the parts of your brain that help you to stay awake, pay attention, and to assimilate new information. If you lack adrenaline in those parts of the brain, it makes all those brain functions and higher functions like planning and organization, makes all of those difficult. There's two sources of adrenaline in the body. One is the adrenal glands, which are attached to your kidney and pump adrenaline directly into the bloodstream. And the other is the neurons of the brain that have adrenaline at the level of the synapse in microscopic doses, but very important because it delivers adrenaline exactly where it's needed to help the brain to function optimally. And if you ask patients what their earliest memory is, the majority of people will remember something that hurt them. You know, touching the hot stove, for example. Why is that? It's because they got a burst of adrenaline and it cemented that memory so that they wouldn't keep doing that. Now, kids with hyperactivity, they keep touching the hot stove. Attention deficit hyperactivity disorder. If somebody really has a lot of hyperactivity, I ask them how many fractured bones they had in childhood. So these are not your regular kids. These are kids who jump off the roof just to see what it's like to land, and then they'll do it again next week. And I've seen kids that have dozen fractured bones before they got into high school. A lot of them are into adrenaline activities like motorcycle racing, for example. And they're good at it. Why is that? Because they get that burst of adrenaline from doing risky behavior, and that really makes them feel totally alert, totally awake, totally tuned in. And so they thrive on that, and they're good at that. It's a pretty common problem. It doesn't necessarily mean it's a handicap. People need to learn to deal with it and manage their adrenaline, basically. We talked about insomnia. If you're chronically sleep deprived, you're going to have difficulty paying attention, and symptoms of attention deficit hyperactivity disorder are going to get worse. If you're chronically under stress, same thing. Depression causes problems with attention, focus, decision making. So all of those things tend to decrease levels of adrenaline in the brain, as well as serotonin and other brain chemicals. So strategies to increase adrenaline, and I'm being simplistic, but these strategies can help with treatment of ADHD. Now the obvious medical strategy is to use Ritalin, which is it's an amphetamine. And what it does, first of all, it's a synthetic adrenaline, Ritalin or amphetamine. And it also blocks the reuptake of adrenaline into the synapse so that it stays in the synapse longer, and you get more bang for the buck for every molecule of adrenaline that you have. So these are stimulants. And the problem with stimulants is that sometimes people become addicted to them. Interestingly, children that are treated with stimulants for attention deficit hyperactivity disorder are less likely to become drug addicts than hyperactive kids that were not treated. And the reason for that is they're not seeking some other source of adrenaline. They're not as likely to be impulsive and make self-destructive choices. So there's a long-standing myth that the use of Ritalin or amphetamines makes people into drug addicts, and it's actually the opposite. People with hyperactivity have a much higher risk of developing chemical dependency. And there's a reason for that. One, stimulants make them feel better because it corrects this adrenaline deficiency, but also sedatives, benzodiazepines, alcohol will calm down the agitation and hyperactivity at the end of the day, and then the withdrawal boosts adrenaline during the day. So a lot of functional alcoholics are running around with red faces and high blood pressure, but they can function better because their adrenaline is pumping because they're in alcohol withdrawal. And then at 5 o'clock, they go back and drink and are able to calm down. And so when you hear the term functional alcoholic, often I think, I wonder what they are self-medicating for. Now, there are non-addictive means of dealing with ADHD. Ritalin, by the way, does not show up as amphetamine on standard toxicology screens. Methylphenidate is the generic name for it. And that's useful. Sometimes I'll have an amphetamine addict who obviously needs treatment for hyperactivity, and I will use Ritalin for them because people don't buy Ritalin from drug dealers. And so if they show positive for Ritalin, it's not a relapse of methamphetamine addiction. Whereas if they do show positive for amphetamine, and that means they got it from someone else besides me. But there are non-addictive means to treat this. There's a medication that's called Strattera that boosts natural adrenaline in the brain and can be as effective as Ritalin. Some people don't tolerate it well, can have side effects like nausea, for example. But if it is tolerated, it can work as well as Ritalin. It's not a stimulant, it's completely non-addictive. And so that can be effective. The other things really, it corresponds with sleep hygiene, being able to get enough sleep, learning how to relax, learning how to focus and concentrate, all are good treatments for ADHD. And just getting enough sleep, can make a big difference. Most adults with ADHD learn how to deal with it without medications. Exercise, I know I sound like a broken record, but exercise is really helpful for ADHD. It improves the production and turnover of adrenaline and helps with focus and concentration. I see a lot of, especially NFL players that I evaluate, I see a lot of them that really function quite well until they got injured and couldn't work out, and then they fall apart. See it all the time in high school kids. They were the star athlete in high school, but they weren't good enough to play college, and they went to college and then just fell apart. They had some discipline structure in their lives, but also it helped them to concentrate. And when they went to college and quit working out, they flunked out in their first semester. So exercise really is, I think, crucial for a lot of reasons, and probably for everybody in terms of cardiovascular health, but especially for ADHD.